Hallo und herzlich willkommen zur nächsten Session hier am Kommunikations Kongress. Das wird eine englischsprachige Session, so that I switch now into English. So, hello and welcome in the room and outside on the streaming and on the screens. So, our next topic will be the future of stakeholder intelligence. My name is Anna Mahler. I'm the press spokesperson of the AOK Saxony-Anhalt, and I'll be guiding you through this next session. After the presentation, we will have some minutes scheduled for questions, and those participating digitally, we are very welcome to send us their questions. We will be very happy to read them for you. Okay, then let's start. Data-driven communications, a multi-stakeholder universe, and ComTech are the biggest trends in corporate communication. Their confluence raises in the importance of stakeholder intelligence. In this talk, Caliber, a stakeholder intelligence company, will go through practical case studies showing how companies can best use stakeholder intelligence tools and practices to boost efficiency, build reputation, and earn trust. Please welcome with me Médard Schoenmaeckers, Country Managing Director Germany and Chairman of the Board Boehringer Ingelheim Deutschland, and Shahar Silbershatz, CEO from the group Caliber, please.
Thank you. Thank you.
You're very welcome.
Thanks. Thanks very much. It's my second time presenting here at Kommunikations Kongress, and I always feel I should apologize in the beginning for speaking in English and not German. So hopefully you can bear with us. As mentioned, I run Caliber, a stakeholder intelligence company in Denmark. We're based in Copenhagen. And very happy and pleased to share the stage today with Médard from Boehringer Ingelheim, who's been our client for the last several years. For those of you who are not familiar with Caliber, we essentially help build trusted businesses through brand and reputation analytics and strategy. We do it across all sectors. We do it in many countries. We're based in Europe, but we have also operations in North America and South America. So our client base is around those areas. So we've been around for 9 years, Caliber, and I've been in the business of brand and reputation for about 25 years. And today we're going to talk about the future of stakeholder intelligence. So probably the first question you have in your mind is, what is stakeholder intelligence? Is it a word that we just invented? We didn't invent it, but we are certainly trying to monopolize it. We used to talk about brand and reputation measurement and data. Today we talk more about stakeholder intelligence. What we mean by stakeholder intelligence is collecting and analyzing information about the people who matter to your business. It's fairly simple. Probably if you feed this into your favorite LLM chatbot, you will see something more or less the same. It helps you manage risks, spot opportunities, forge stronger relationships with your stakeholders, but also make better business decisions and build trust. So the idea with stakeholder intelligence, and the reason we call it like that, and I'll explain in a minute how things have changed, is because this discipline has evolved quite a lot over the years that we have been around. Now, in the past, stakeholder intelligence really was traditional research. Traditional research meant it was something that was pretty complex, fairly expensive, done on an ad hoc basis, so maybe done periodically, so maybe once a year, once every other year. And of course, paper-based reports, so you did some field work. After a few months, you got a big report, paper-based, back in the days, or PowerPoint later on. And the issue with that, other than that it was a bit of heavy lifting and expensive to get off the ground, the issue was that it didn't have a lot of explanatory power. So you did it once a year or once every 2 years. You really got the answers to the questions that you asked. You couldn't really do much analysis or understand why are scores changing, why are people's perceptions changing, how does that relate to what we're doing in the company or what's happening out in the world. You couldn't really answer all these questions because you had a point-in-time research that took you a long time to actually get the results of. So that was the past. That changed in 2016. What happened in 2016? Thank you. I'm making sure you're paying attention. 9 years ago was 2016. So we were the first maybe to do that, but not the only ones. Today there was others are doing it. But what we basically did is trying to bring technology to the space of stakeholder intelligence or reputation measurement and actually presenting a new reality where we don't do this once a year, we actually do it every day, and we do it continuously, it's always on, and the results are available in real time in a dashboard rather than a PowerPoint report. The idea was not just to democratize data, to actually allow a lot of people in the company to access data, not just centralize it in one department or one person, but also to reduce the costs, to make it a lot easier for companies to jump on the bandwagon. And of course, to make it a lot more actionable, to increase the explanatory power. Because when you have continuous real-time results, you can start contextualizing the results with what you're doing as a business, the campaigns that you're running, the products you're launching, the news that you're releasing, what your competitors are doing, what's happening in the world, also geopolitically and so on, all of it affecting, of course, perceptions of stakeholders. You can contextualize it much better, and that means that you can actually understand the question why. How do you answer the question why? Why are perceptions what they are? What do I do now? These questions that we could never answer before. So this is what we have done, and that has brought more actionability, and that means that companies can be more agile and take decisions on the fly. But things are changing beyond that now. So primarily because technology is improving, not just AI, but technology in general, we're getting to a reality where it's a little bit different from what it was before, in the sense that companies are trying more and more to integrate data sources. Integrate data sources, analyze them together, make sense of them, and do it fast and do it all the time. AI is definitely helping with that, but also automation of insights and reporting, and a lot of other dashboards and platforms that allow you to integrate data. What we're seeing now with AI-powered analysis is that it's actually not just allowing you to be faster in analyzing the integrated data sources, but it's actually allowing you to be not just descriptive, but also predictive and prescriptive. So you can start looking at future scenarios with AI, and that's great. So the explanatory power, which is very important when you're dealing with data, to not just get and read the data, but actually understand why and what you do with the data, that's growing very, very fast. So things have changed, and other than the integration of different data sources, we're seeing that there's been a big change over the last year of moving from single stakeholder to multi-stakeholder. You'd be surprised, or maybe not. I'm always surprised by how many companies still only track their customers. They don't care about perceptions of other stakeholders. It's all about the customer. This is your average brand tracker out there. That's still the case, but there is a big shift towards a multi-stakeholder universe where you try to understand all your stakeholders. There's a shift from looking at backward-facing data to actually data that tells you what's happening now and maybe even what might be happening tomorrow. And probably the biggest shift that's happening is going from looking at data, which is what was the case before, KPIs for reporting purposes, not for making decisions, but for reporting, what we call vanity KPIs, actually to doing stuff with data, not just looking at it, but doing something with it. So all of that is stuff that's been happening for several years, and you know that, but AI is accelerating this process quite substantially, and it's also facilitating this. So with AI, things are done faster and easier when it comes to data analysis, clear insights from multiple sources, and also, in some cases, looking at simulated data that can help you predict and run different simulations. So it's changing the field in many ways, and I want to share with you how we do it today at Calibre and how we're incorporating AI. And for that, I'm going to take you a little bit into the architecture, so if there are any competitors in the room, they should leave the room now. Otherwise, you're welcome to stay. That's just a joke. So we're using AI to aggregate and analyze multi-source data in order for us to understand what's happening with perceptions, what's happening to our reputation, and why, right? So what we've done over the last few months, and others are doing similar things, but with different approaches, is actually looking at, okay, the survey app, which we have in our platform, is still there. That's still the mainstay of what we do. We survey people online every day, all around the world. We do it in more than 40 countries. We ask questions about more than 5,000 companies. We try to gather a lot of intelligence about perceptions that people have of different companies across stakeholder groups and sectors. But we also uploaded on the platform all of our thought leadership. We do a lot of studies and a lot of special reports about industries, about geopolitics, about different events that impact reputation. All of that, which used to be on our website, is now sitting also on our platform. In addition to that, we're bringing more and more external data into our platform. External data can be a host of things. Media monitoring, of course, is very important, so we have a media monitoring solution as part of our platform. We also work with our clients' media monitoring solution, social, traditional, but we also plug into the platform a lot of public sources, be it market data, or that can be share price, for example, or filings, or it can be the websites of our clients and their competitors, industry news. It can be media outlets, it can be academic resources, all of these things that are publicly available, we plug into the platform as well. And of course, there's external data that we get either from the clients or from other sources. That can be clients' financial data, for example. It can be their campaign spend, their budgets, whatever it is. All of these things can go into that, and these are all uploaded and fed into our data warehouse. So whereas in the past, we just used to do these two, today, we actually expanded our data warehouse to be able to aggregate a lot of different data points from a lot of different data sources that all feed into the AI assistant, of course. So not all of the data gets visualized on our platform, but all of the data is used to train the AI assistant that sits as an interface on our platform. So, of course, there's the online platform itself where you can interact with the AI assistant, our clients can interact. They can also look at the data in the traditional way, but gradually we and them are using more and more the AI assistant to be able to answer questions that require a host of sources in order to answer those questions, not just survey data about stakeholder perceptions. So our clients can basically, instead of doing the traditional thing, which is look for the data on the platform, find out the graphs and the tables and the charts that they actually are looking for, they can just ask a question and draw the charts and start asking why. Why has my reputation for innovation dropped in Japan over the last couple of months compared to the main competitor, especially among students? Did anything happen? Well, maybe the competition has launched something that is targeted at students, and that's perceived to be better than what we have. And maybe that's something you can find on media, or maybe that's something you can get from press releases or something else. So the engine is trying to answer those questions. It's never perfect. It's always training and training and training, which we do every time for each client separately. But it starts helping you answer questions of why, and hopefully soon also what to do now. So where are things going right now with AI, the way that we see it? It's still in development and progress every day, as you know, because the technology is improving every day. But we're seeing AI continuing to help companies, especially in our field, do a number of things that will make their job easier. Predict stakeholder concerns before they arise. So today, that's not something that we can do. Today, we can pick up on issues or concerns as they emerge. We think that gradually, the AI functionality will allow us to start picking up signals that can be earlier detectors of some of those concerns based on previous behavior that we're seeing from the database, because our database goes back about 10 years. Respond to crisis in real time. So again, picking up signals of potential crisis, but also prescribing potential solutions or potential mitigation strategies based on what you've seen in the past. Continuing to automate routine analysis. And that's important because it's already done, but the more we do that, the more we can actually release capacity in the communication teams to do what humans need to do. The real authentic engagement that AI, we think, will never do, and less of the pedestrian analysis, data analytics that is done quite a lot today, and personalized communications at scale, which is something that has been talked about a lot, and something that's still in the process of happening. So we think that, are we on the cusp of a revolution? I don't know. There's definitely a massive change going on right now, and our platform has changed quite a lot. But we still think that a lot of the big impact is ahead of us and is coming up. But there is a but. We are seeing some risks in how AI is being applied and adopted in stakeholder intelligence. One risk is that more and more use, for example, of synthetic data means that people are no longer valuing the input of real people. That's an issue for us because we, in our origin, we're used to talking to people and asking them how they think and what they think and how they feel about companies. We don't think synthetic audiences can do that. They certainly cannot do it on a continuous real-time basis because you have to keep retraining the synthetic audiences, redesigning them every day based on what's happening around them. So we think there is a little bit of a risk of loss of real input by turning more and more into synthetic data and simulations. Another risk is, of course, the human in the loop question. For us, it's more the human in the loop. It's the expectation that AI can actually help you prescribe behavior. How do you need to communicate? How do you need to behave? How do you need to react? The thing for us is that at the end of the day, building trust is a human quality. You need humans in order to build trust with humans. We don't think AI can show the same empathy as a human being can or engage a stakeholder in an authentic way as you can as people in the company. So we think that this focus on people must stay there in order not to dilute the way companies build trust. And lastly, how do you actually use data in decision-making and management? A lot of companies already drown in data. I've been drowning in data for many years. That doesn't necessarily mean that they use the data well to make decisions, both at management level and at the user level. So data fluency, we think, becomes even more important now as an area to train both management and users across disciplines and teams in order to not just have data at their disposal, but actually use it in an effective way. And Médard is going to talk about that from the user side.
Thank you. Thanks, Jan. Yes, thank you so much. So, good afternoon, everyone. Some of you I know, or have known for a long time, actually. Some of you, or many of you, I don't know. And maybe just a word of introduction, Médard Schoenmaeckers. I joined in my current role about 6 months ago. Before that, I was one of you. I've been in corporate affairs and communications for many, many years, in several companies, in several industries. So I know your world, I love your world, but I held up my hand and moved on and now have this great role where I manage the German market of Germany's largest pharmaceutical company. We are a research-based pharmaceutical company. That is important for this talk, that's why I'm saying it. They're not a generic producer, but a research-based company, so we try to find new diseases. And I wanted to bridge to that. I want to bring us back to the core of our business first. And I do that because I believe, that's me, and I do that because I believe that AI, looking at AI and AI applications and stakeholder analysis cannot and should not be done in isolations in our corporate affairs worlds. I think it will be a real mistake to stay in your own bubble. Yeah? For the applications that we've done so far, let them write a post and make sure that the tone of voice, all these application AI, fine. You could do that in your communications department. But when it comes to stakeholder analysis, you really want to look more holistically at the company and be part of actually what happened in the company. And yeah, so picture this, to go back to the core for a moment. Picture a friend or picture a family member. We all know someone who got a diagnosis, and that was not a good diagnosis. That was a rather unfortunate disease. Yeah? And you think that your world falls apart, but the doctor says, but there is hope. The world isn't lost yet, there is hope. There is this medicine. We're not quite sure whether it will help, but it might help. The only problem is, I hope that you have another 10 to 12 years, because that's how long it takes for pharma companies to get to a new medication. Yeah? And the problem for us is that the risk is very high and the cost is very high, because on average it costs you, well, I'm being conservative here with 1 billion for a medicine, because we easily can go to 2 billion before we have actually a medicine that we had to invest, before we have a medicine that can go onto the market. So 10 to 12 years, maybe even 15 years in some areas, mental health, for example, very difficult area, 1 to 2 billion costs, and a success rate of 5%. So of every 20 attempts of what we think is a medicine that will have the potential, even for those projects, only 1 in 20 will actually see it to the market. And I don't want to sort of make this a doom and gloom story, but it is the reality of where we are today as a research-based company. There are some 30,000 diseases known to us, but only some 10,000 diseases we have an answer to. And that's also something that doesn't make us feel, we're frustrated about that as researchers. We want to have answers for those patients who have the other 20,000 diseases that we don't have an answer to yet. So 10 to 12 years, 1 to 2 billion, a 5% success rate, and only 1 in 3 we have an answer to. And that is not good enough for us. That's just not good enough. But it's been the reality for many, many years, right? Until now, we believe, because for the first time, we now believe that AI can actually make a real difference and can help us tackle some of the hurdles that we've just seen in research, in development, with our regulatory process, and ultimately in how we produce it and bring it to a patient. And so we believe at the moment that the 10 years that it would take to bring a new medicine to the market, through the use of AI and through the smart use of analyzing data, the data that's out there but that we're just not using, we believe that we can bring this back with 2 to 4 years. And that's now. And so with AI being at the start of what I believe is a big development, I think we can go further away in the future. We can even go down more years. So how does it help us? Yeah? In R&D, we have AI models now who can already target molecules and can do a lot of the computational, what would that molecule do in a human body without us having to test it. So we have lots of patient data. And by putting those by structuring the patient data and letting a certain molecule structure go into those profiles, these days AI can already tell us what the toxicology, for example, would be. Can the body bear this or not? Would really the desired effect be there or not? So this is how AI already today helps us. Then we need to find the right patients. What we did up to now is we thought we had something, and we call that a clinical endpoint. So we think we have an answer to a disease. This is the solution. But no one's asked the question, is this what most comfortable to the patient? Is this really what the patient needs, etc.? Now we have data, patient data, that we can mine to understand for that certain segment, could this be the right solution, or do we need a different solution? So already in the creation, we know what the patient may want, and that would never be possible without AI and the mining capabilities in those patient data. We can then create a narrative that we can bring to a regulator, to also a politician. This is where your domain now starts to come in, right? When we need to go to politicians and tell them, actually, there is a need for you to look more at kidney or at heart or at cancer or whatever the disease is. The same with healthcare professionals. So how do we know now that we have the data, we can look with physicians through their computer in a way, all anonymized, of course. So we understand, does a certain cardiologist, do they refer to this doctor or do they refer to that doctor? So you get a lot of information now as we mine that data that will help us be more targeted in helping doctors also use those treatments in the right way. And then finally, and that's a super exciting area, of course, AI and personalized care. Medicine becomes ever more personal, and we need to, we can use data, patient data, analyze patient data, also to have apps who have clinical answers to patient problems. For example, we're testing something currently in schizophrenia, where an app can talk to a schizophrenic patient and help the patient when they have, and AI actually will recognize that. So you can see through the entire journey, AI plays a critical role, but only based on the data that we have and that we've mined from patients, from doctors, etc. Bring it back to your world, because I want to end on comms and corporate affairs. There is a real role for you as well, because this is not just a technical exercise. We've come to the realization that we need to create a different mindset. This is a culture shift as well in organizations, right? And if you look at outcome-based, predictive, and trust-based, you recognize a lot of words that actually we use in communications all the time. We can now, what I said already, we can now, rather than predicting or thinking actually what they need, we now know what patients need before we start researching. We can predict much more. We're now looking at patient data, for example, of healthy patients, of yourselves, through doctors. Again, anonymized, right? We don't know it's you. By doing that in an early stage, when a disease would occur, we can go back and see, do we see in certain populations actually that certain genes started to behave differently, or certain metabolic things started to happen differently. So we can already predict before a disease happens that it might happen. That will really reduce the cost of the healthcare system, but it will also hopefully avoid lots of diseases that we want to avoid in the first place. And then trust. We believe there's a real role for AI and stakeholder analysis in building trust, because you come with a very different level of data, a very different level of analysis to your stakeholders, to politicians, for example, to regulators, to doctors. And that higher level, that more sophisticated level of narrative will help us also in creating more trust towards patients as well, not in the last place. So I have no time, right?
Right, I'm sorry.
because I wanted to bring it back to you, but I'll keep it very short, because the core message of this slide was, I don't have a case to present to you that is the perfect case. I'm sorry to say, yeah? But I don't think that any of you will have that case yet, because we can't be at that level yet. Yeah? So what we're currently doing is taking a structured approach of looking at the hundreds of touch points that we all have, whether they're online, whether they're from data, from patient data, whether we get them through the reputation dashboard of Calibre. There's hundreds of touch points that deliver data. We then need to structure those, because data from touch point A are completely different from touch point B, so you need to harmonize that. So you have these different platforms that will then analyze it. We funnel that. Yeah, I'll forget the detail in the sake of time. And then ultimately, once you've structured that pool data, then you can actually start to analyze. And then we have one analysis methodology that will help do that. We're doing that, again, not in isolation. So all the data that we provide is actually available for everyone in the organization. Because the data that you in Calibre provide for us, you're also interviewing doctors. Yeah? And I loved already a few years ago the fact that I could go back into your system and say, how many doctors, what's the viewpoint of pharma, of a cardiologist who himself has one cat, we also have a animal health business, and is a diabetic patient. You could go but now what we are able to do is, with that data, is actually to see patterns. Would a doctor who has diabetes himself behave differently than a doctor who doesn't have that disease himself or herself? And so you can go a lot deeper, and therefore the answer that we provide can be a lot more precise. I think I'll leave it at that. I think you got me there, because basically there is no answer. It's not so easy. We're not there yet. Yeah? I said earlier, I believe I can see most of the AI applications stall at 80%, as we say internally, and the rest is still manual process. And sometimes you think, shouldn't I do it the conventional way then, because the technology doesn't deliver? However, I do believe this is part of the development, yeah? And this is how any development has happened. And I think 2-3 years from now, when we sit here together, I think we will all understand a lot better how this works for us. I think with that,
we have time really for just one question.
Oh, really?
Yes.
Shahar, where you want to come up?
If we have any questions here in the front. Just wait a second for the microphone, please.
Thank you. If I may ask, I mean, the numbers you mentioned at the beginning of your presentation, like 10 years development time, do you have predictions how that will change using AI?
Yeah, so I went a little quick, Clarissa, I think, but the 10 years now, we're currently working with a model where we bring this back with 2 to 4 years. Depends a bit on the disease. How complex it is, but we believe we can bring this back with 2 to 4 years, only with the use of AI and feeding that data, and through that data predicting more, or letting quantum computing. We're working with Google in a quantum computing setting, but all that data is being analyzed, and basically we can move ultimately away from animal testing and from in vivo, so patient testing in clinical studies, to what we call silicone testing, because it will happen basically in quantum computing. And we already have a first project with a German university, where parallel to a clinical study for a new medication, which we do in patients, right, with patients, which we also do in silicone, as we call it, so through AI and quantum computing together, put together. And we're looking at how do these run in parallel. Of course, one study is already finished, the silicone study is already finished, while the recruitment of the other study is about to start almost, right? That's how fast this goes. But we want to see how do the outcomes differ, or how the same are they? And so hopefully these projects will also convince regulators for us to be able to move and advance some of that classical study work.
Yes, our time here is over now, but we have tonight. We have our speakers night, so you can find yourself and discuss this maybe later. Yeah.
Thank you.
Thank you very, very much
Thank you
for this. And this was your audience.
Thanks. It's good.